Hello, my name is Lynn Keltika, and I'm employed by the Division of Reproductive Health at CDC to work as a senior maternal and child health epidemiologist in the state of Louisiana. This presentation shows the results of a comparison of two different maternal mortality review processes to identify and classify pregnancy-related deaths, one at the national level and one at the state level. The format of the presentation will be very standard, presenting a background, methods, results, conclusions, and implications. Maternal mortality requires a common ground of definitions to understand results. Pregnancy-associated deaths refer to deaths that occurred during pregnancy or within 1 year of the end of pregnancy, regardless of the cause of death. This represents the total universe of maternal mortality cases. Within pregnancy-associated deaths, there are three subclassifications. The first is pregnancy-related. Pregnancy-related deaths are those where the cause of death is directly related to the pregnancy or a chain of events initiated by the pregnancy or its management. In other words, these deaths would not have happened in the absence of pregnancy. One example would be an amniotic fluid embolism, another would be eclampsia. The second classification is pregnancy-associated but not related deaths. These occur during or within 1 year of pregnancy, but the cause is unrelated to the pregnancy. In other words, these deaths would likely have occurred regardless of pregnancy. One example of this type of death could be an automobile accident. The third classification is pregnancy-associated but unable to determine relatedness. These deaths are exactly that, cases where, even after review of all available information, it is not clear whether the cause of death was related to the pregnancy or not. A couple of examples of this might include suicide or drug overdose. Note that all of these definitions assume that a pregnancy could be confirmed at the time of or within the year prior to death. If a pregnancy could not be confirmed or occurred more than 1 year prior to the date of death, the case would not be reviewed or classified using these definitions. There are three main sources of maternal mortality information in the United States. The first is CDC's National Center for Health Statistics, National Vital Statistics System, mortality data. This system reports maternal deaths based on ICD-10 codes only. The specific codes that are included are A34 and the O chapter codes of deaths up to 42 days past the end of pregnancy. There is no classification of pregnancy relatedness. Deaths are simply counted on cause of death reported on the death certificate. Since they are enumerated from the Vital Statistics National Repository, there is no confirmation of pregnancy or the timing for the death. The second source is CDC's Pregnancy Mortality Surveillance System, which covers pregnancy-related deaths up to 1 year past the end of pregnancy for the nation. And the third source is located within individual states and tends to focus on recommendations to prevent future deaths based on careful multidisciplinary team review of all available records for pregnancy-associated and pregnancy-related deaths. CDC's PMSS is housed in the National Center for Chronic Disease Prevention and Health Promotion, Division of Reproductive Health. Jurisdictions voluntarily send death records of women who died during or within 1 year of the end of pregnancy, linked live birth or fetal death records, and any additional data when available. Cases include deaths with an ICD-10 Chapter O code, along with deaths where the pregnancy checkbox indicated a pregnancy within the year prior to death or matched to a live birth or fetal death certificate. A team of medical epidemiologists review all cases received from the jurisdictions to classify deaths as pregnancy-related or pregnancy-associated but not related. There are two additional classifications in PMSS that do not get counted because they are deemed ineligible. Since PMSS is interested only in deaths that occur within 1 year of the end of pregnancy, deaths where pregnancy was determined to have occurred more than 1 year after pregnancy are classified as such and excluded from the final count. Also, cases where no indication of pregnancy could be determined, PMSS classifies those as sent in error, essentially a false case. A hypothetical example of this might be a cause of death of lung cancer, with a checkbox indicating pregnancy 43 to 365 days prior to death, but no live birth or fetal death certificate could be found. Once all cases are reviewed and classified, PMSS calculates and reports a national pregnancy-related mortality ratio, which is the number of maternal deaths per 100,000 live births. Note that the end goal for PMSS is to use the review process to identify pregnancy-related deaths. Data are typically reported 2 to 3 years after the calendar year in which the death occurred. Currently, the most recent year reported is 2017. However, 2018 reviews are in process, but may be further delayed due to the COVID response. It is important to remember that PMSS produces the only national pregnancy-related mortality ratio. PMSS also reports these ratios by race and ethnicity, as well as the proportion of deaths due to specific causes. Louisiana is one of many U.S. states that conducts its own in-depth reviews of maternal deaths. Cases are identified through a combination of data linkages of deaths to live birth or fetal death, and separately, perhaps hospital discharge data, and the pregnancy checkbox indicating a pregnancy within the year prior to death. Louisiana's reviews are coordinated through the Louisiana Department of Health, Office of Public Health, Bureau of Family Health. After epidemiologists identify the deaths, records are sent to nurses who work with hospitals and coroners to first confirm that a pregnancy had indeed occurred within the year prior to death, and, if so, to abstract all available supplemental records to be presented to the Multidisciplinary Review Committee. When no evidence of a pregnancy within the year prior to death is found, the death is classified as a false case. Similar to PMSS, results are typically posted publicly 2 to 3 years after the calendar year when the death occurred. The goal is to have all deaths reviewed within 2 calendar years, and then the report published in the 3rd year. As such, Louisiana published its 2018 review recently, and has just completed its review of 2019 cases and will be working on the report in early 2022. Louisiana's MMRC seeks to classify all maternal death cases as pregnancy-related, pregnancy-associated but not related, and includes the classification of pregnancy-associated but unable to determine relatedness. The Louisiana Maternal Mortality Review Committee classification is considered the gold standard due to enhanced access to detailed medical and autopsy records. Why is it important to compare the classification by PMSS to Louisiana's MMRC? PMSS reports the only national pregnancy-related mortality ratio where the deaths have been individually reviewed to classify pregnancy relatedness. However, PMSS relies on individual jurisdiction identification of cases, which may or may not happen in the same way between jurisdictions. Further, differences in case identification may exist between a state's Vital Records Office and an MMRC that identifies cases using supplemental data sources, such as hospital discharge or medical records validation. There is no real way to know if PMSS has received all of the potentially eligible cases from a given jurisdiction, and there is no absolute way that PMSS would be able to tell if a death certificate, for example, indicating pregnancy at the time of death, was really true without having access to supplemental records. This comparison is especially important to Louisiana, as identification and validation of maternal deaths and their causes and preventability remains a top priority. Beginning in 2016, Louisiana has participated in several multi-state work groups to improve both case identification as well as data quality. With the additional focus on our internal records, it made sense that a next step would be to see how PMSS's classification compared to our state's classification based on our own in-depth multidisciplinary reviews. This work addresses two main study questions. First, what is the Louisiana pregnancy-related mortality ratio calculated by PMSS compared to Louisiana's MMRC? And second, what is the sensitivity, specificity, and positive predictive value for Louisiana pregnancy-related deaths using Louisiana's Maternal Mortality Review Committee data as the gold standard? PMSS shared their classifications of 2017 Louisiana deaths with Vital Records, who further shared this information with our MMRC staff. Each record included a state death certificate number that was used to link the PMSS data to Louisiana's MMRC data. Thinking back to the case definitions, both systems classified cases as pregnancy-related or pregnancy-associated but not related. PMSS also classified deaths as ineligible if either the pregnancy occurred more than 1 year prior to the death, or if the review team concluded that a pregnancy within the year prior to death was unlikely. Both of these scenarios were classified as false cases by Louisiana's MMRC. Louisiana's MMRC also classified deaths as pregnancy-associated but unable to determine relatedness, a classification that PMSS does not use. The pregnancy-related mortality ratio was calculated based on the classification from each respective system of the number of deaths that occurred during or within 1 year of the end of pregnancy that were classified as pregnancy-related, expressed per 100,000 live births. Only records that were classified by both systems were included in the validity analysis. For results, PMSS reviewed and classified 61 Louisiana deaths. Louisiana's MMRC identified 91 deaths, of which 26 were classified as false cases, resulting in 65 cases being reviewed and classified by the MMRC. Both PMSS and Louisiana's MMRC classified 15 deaths as pregnancy-related, resulting in a pregnancy-related mortality ratio of 24.6 deaths per 100,000 live births for both systems. PMSS classified one case as having occurred more than 1 year past the end of pregnancy, thereby excluding it from the final count of pregnancy-related deaths for 2017. Louisiana's MMRC also deemed the case ineligible to be included in the 2017 count. Of the 30 records that Louisiana Vital Records did not send to PMSS, 25 were found to not have any documentation of a pregnancy in the year prior to death. The MMRC classified those as false cases, and they were not reviewed or classified. The remaining 5 cases that were reviewed by the MMRC, none of them were classified as pregnancy-related. PMSS classified one case as having occurred more than 1 year past the end of the pregnancy, thereby excluding it from the final count of pregnancy-related deaths. Louisiana's MMRC also deemed the case ineligible to be included in the 2017 pregnancy-related count. Of the 30 records that Louisiana Vital Records did not send to PMSS, 25 were found to not have any documentation of a pregnancy in the year prior to death. The MMRC classified those as false cases, and they were not reviewed. The remaining 5 cases that were reviewed by the MMRC, none were classified as pregnancy-related. For validity analyses, of the 60 cases that were reviewed and classified by both systems, sensitivity was 86.7%, specificity was 95.6%, and positive predictive value was 86.7%. In conclusion, both systems reported the same pregnancy-related mortality ratio. and PMSS demonstrated good sensitivity, specificity, and positive predictive value for 2017 Louisiana pregnancy-related maternal mortality. In conclusion, both systems reported the same pregnancy-related mortality ratio. PMSS demonstrated good sensitivity, specificity, and positive predictive value for 2017 Louisiana maternal deaths. As maternal mortality continues to be a priority in Louisiana and nationally, accuracy in identification and classification is critical to consistent reporting of maternal mortality ratios and effective monitoring of trends over time. This comparison of results from independent review processes supports confidence in CDC's PMSS classifications of Louisiana's pregnancy-related mortality. Please reach out to me through the conference mechanisms or at the email shown here for questions or additional information. Thank you so much.